time talking about children of alcoholics and how it affects them. I will also be discussing addict family system survival roles. So to start off, children of alcoholics often experience PTSD similar to war veterans and Holocaust victims. They learn to shut down their emotions to survive. Consequently, they re-experience feelings of childhood trauma as adults. These symptoms are they can re-experience the trauma through nightmares, emotional overload, and survival behaviors. They have psychic numbing, which is feelings of emotional anesthesia, constriction of emotions in situations of intimacy, and they have confusion instead of having feelings. They suffer from hypervigilance, which is an inability to relax, or includes chronic anxiety and panic attacks. They have survivor guilt, which is chronic depression and a sourceless sense of guilt. These symptoms are intensified when exposed to events that resemble original trauma. The roles that these family members take on when they are members of a family who has an addiction are basically just coping mechanisms to use to survive a dysfunctional family with addiction. They include the 5 main roles, which is the chief enabler, who assumes the primary responsibility for the chemically dependent family member. So they are the ones that take care of the person who has the addiction. The family hero is the responsible child, the good or model child, so the child that does their best in school, maybe is involved in extracurricular activities. The family scapegoat, their goal is to divert family members away from the real issues in the family. The family can then blame the scapegoat for all of their family problems. So maybe they don't live up to the family hero and they don't do great in school, and so the whole family can blame all their problems on them. The lost child is the child who allows family members to expend less energy. He or she takes on the family pain. So they kind of just slip into the background and nobody really worries about them, but they're very worried about everybody else. And finally, the family mascot diverts attention away from family issues. They use humor and silliness. So they're basically just there to make everybody laugh and to entertain and hopefully take away from the real issue.
The topic of our project is alcoholism among families, and the purpose is to educate parents about the effects alcohol has on their families. Growing up in an alcoholic family is a family disease. It affects each member. The family organizes themselves around the alcoholic's behavior and their drinking. The family responds to the alcoholic in a codependent way, which enables the drinking and their behavior. As a result of this, the family members disconnect their own feelings and their perceptions become distorted. There are 3 different rules for families of addicts. The first is don't talk, the second is don't trust, and the third is don't feel. There are also 4 different types of family boundaries. The first is rigid families. The rules in this family are strict with no exceptions or flexibility. Values are that things are always black and white and there is only one way of thinking of things. The second is ambiguous families, where the rules don't need to be enforced and are changed if someone is annoyed. These values are always changing per situation. The third is overextended families, where the rules are to be productive, get busy, and stay on the move. The values are to achieve and look good, and the feelings are just for wins. Distorted families are where the families are to act normal, don't let outsiders know that we're crazy. The values are to maintain an illusion of normalcy despite the fact that we are all experiencing physical and emotional problems in the family. Next, we'll discuss how adult children of alcoholics are affected. These individuals have a difficult time forming close relationships. They have less attachment to loved ones and are constantly obsessed with trying to control their environment. They utilize approval seeking and social acceptance as coping behavior. Women are especially affected. and they struggle with denial of feelings. These individuals are at risk for eating disorders, chronic anxiety, learning disabilities, low relational satisfaction, and low self-esteem. In order to treat these individuals, it requires a change in their core belief system, which is difficult to do. They need to change their defense mechanisms and their feelings about themselves.
If you are, or someone you know is, an alcoholic parent, here are some treatment options for you to get on a path to a healthier life. Treatment for alcoholism includes therapy and medications. We will discuss therapy first, as it is the most prevalent and extensive. There are multiple kinds of therapy, which include 1. Support groups, 2. Behavior therapy, 3. Cognitive behavioral therapy, 4. Psychotherapy, 5. Counseling, and 6. Family therapy. The first one we will talk about, support group, is a group of people who have a similar condition, such as alcoholism, that get together to share experiences and support on the road to recovery. An example of a support group is Alcoholics Anonymous, which typically uses the 12-step model to recovery. The 12-step model provides a framework for recovery with a progressive list of steps to achieve. The second, behavior therapy, primarily focuses on changing behaviors to assist in overcoming detrimental or unhealthy habits, such as our topic today, excessive drinking. Number 3, cognitive behavioral therapy, is similar to behavior therapy, but it starts with the mind. It is a form of talk therapy that begins by attempting to change a person's thoughts in order to alter their behaviors. Psychotherapy, fourth on this list, is also a form of talk therapy that is designed to treat mental disorders. This is beneficial for alcoholics because other mental disorders such as depression often accompany addiction. Number 5, counseling, is where one can go to receive advice and support to help solve problems and make better decisions. The sixth form of therapy we will discuss today is family therapy. Family therapy is a form of therapy that benefits the whole family of someone suffering a form of addiction, in this case, alcoholism. It is psychological counseling that educates families on how to communicate and resolve conflict more effectively. This particular form of therapy is highly recommended due to our discussion on the impacts of addiction on the family throughout this video. Family members are deeply impacted by another family member's addiction and can benefit from therapy as well. They can also be highly instrumental on the path to recovery for the individual suffering the addiction. Next, we will discuss medication, another form of treatment for alcoholism. Medications can include sedatives, such as Librium, which cause calmness and dulled senses. Alcoholism medications such as disulfiram and acamprosate, which treat chronic alcoholism by minimizing cravings and creating negative side effects caused by alcohol consumption. And lastly, vitamins, such as thiamine, which promote healthy body function. In addition to therapy and medications, detoxification is also a treatment option if additional help is needed. Detoxification takes place in a hospital or a medical facility. It is a program that one enlists in to clear toxins from the body through dieting, fasting, and/or colon cleansing. This program takes place under the supervision of a health professional. If you are suffering from alcoholism and are looking for treatment options, start by contacting any one of the following professionals in your area.